Johnson & Johnson says a second dose of its one-shot coronavirus vaccine offers greater protection against the virus. The company cited the results of a new late-stage study Tuesday and says it's in talks with the FDA and other regulators about a possible booster shot. Meanwhile, several states are facing a shortage of a coronavirus drug used to prevent severe disease. The Biden administration imposed new limits on orders of monoclonal antibodies last week. Mark Strassmann is in Tennessee, where the state is being forced to choose who gets the treatment.
Johnson & Johnson's big news: a second dose of its vaccine is 94% protective against symptomatic COVID in the U.S. Nearly 15 million Americans already have received the single-dose regimen. Tonight's other headline affects a treatment for people with COVID called monoclonal antibodies, synthetic antibodies that reduce death or hospitalization by at least 70% in high-risk patients.
It's essentially boosting your own antibodies and your immune system.
Problem is, not enough supply, especially in states like Tennessee with low vaccination rates. Barely half of eligible people here have been fully vaccinated, America's fifth lowest rate. Until last week, most of the limited supply went to southern states where vaccination rates are low. Last week, the Biden administration said it will reallocate supplies across all 50 states. And with more demand than supply, Tennessee's new policy prioritized the unvaccinated. So vaccinated people who get breakthrough infections might have to go to the back of the line. The State Department of Health said in a statement, ultimately, this comes down to providers' clinical judgment to ensure those most at risk are receiving this treatment.
Isn't there potential you'll have to ration care?
I think we'll have to use intelligent decision-making in terms of deciding who would benefit the most from the care.
Dr. Karen Block runs Vanderbilt's COVID infusion clinic in Nashville. It administers 80 monoclonal antibody treatments a day.
In the minds of unvaccinated people, this is their safety net.
If it is, that's probably the wrong way for them to be thinking about it.
These clinics typically have no way of verifying someone's vaccination status. It's the honor system. So, Elaine, here's a new potential problem. Vaccinated people claiming they're unvaccinated in order to get the treatment.
Mark Strassmann, thank you. For more, I want to bring in emergency medicine physician Dr. Hilary Fairbrother. Dr. Fairbrother, welcome. Thanks very much for joining us. So President Biden addressed the pandemic on the first day of the United Nations General Assembly Tuesday. He's also hosting a coronavirus summit on Wednesday. Let's listen to some of what he had to say.
Bombs and bullets cannot defend against COVID-19 or its future variants. To fight this pandemic, we need a collective act of science and political will. We need to act now to get shots in arms as fast as possible and expand access to oxygen, tests, treatments to save lives around the world. And for the future, we need to create a new mechanism to finance global health security.
Dr. Fairbrother, the U.S. has been accused of hoarding vaccines, as have other wealthy nations. So what do you make of the president's comments and where the U.S. stands in helping to get this global crisis under control?
So I think in this and in many other respects, the U.S. is seen as a leader as it pertains to fighting coronavirus and being a world leader in science and technology. This is a really hard decision, and I know that there have been a lot of accusations fired all around the world and from the WHO. In reality, each country has been vaccinating its own citizens, and the U.S. has done a lot to send as many vaccinations as possible to other countries, particularly when we were waiting for vaccines to, say, be approved by the FDA, even to get that emergency approval. So I think we all need to consider balanced approaches. We certainly need to vaccinate people in this country, but it would be lacking insight to only think about vaccinating people in country. We do not live in a world where there is no travel and where there is not communication, both physically and otherwise, between all of the different countries in the world. And so because of that, any real long-term solution to COVID-19 elimination, or at least control, requires a global response. So I think Biden is showing that the U.S. is willing to lead in this response. They promised 500 million bought vaccines, but we can't be alone in taking care of the entire world. And I don't think that the world is asking for that. I think we all need to work together to get as many people across the world vaccinated as quickly as possible. And he was acknowledging that in his address.
Well, Johnson & Johnson, which has a one-dose COVID vaccine, now says a second dose offers 94% protection against the virus, but one shot of the vaccine is just 66% effective at preventing moderate disease. So I have a couple of questions on this, Doctor. I'm not sure if you can answer. First of all, are these data peer-reviewed? The ideas of, when I think people hear about information like this, it's not always clear. Is this the company's data? Have other entities reviewed this? And also, could this mean that the J&J vaccine should actually be not a one-dose shot, but a two-dose shot?
So a couple questions there. So is the data peer-reviewed? So what you will see is our organizations such as the FDA and the CDC reviewing the data of these companies as they're putting it out. And as you can imagine, a lot of the early data that comes out from the Johnson & Johnson vaccine or Pfizer or Moderna is financed by that company. And of course, we always want to make sure that we are double checking data and checking for bias. So I think that's a wise consumer, and it's wise to just say, wait a minute, let's make sure that the data is correct. And earlier in this pandemic, we saw some of the Johnson & Johnson data was actually changed and corrected when the FDA actually looked more closely at their initial data for their vaccine trials. I think what is clear is that these vaccines are very safe and they are very effective. And that includes our J&J vaccine. The single dose has not been shown to be quite as effective as the two-dose mRNA vaccines. And it was natural that they were doing this study and that they were looking for the long-term effects of perhaps adding on a booster shot or a second dose. I think it's exciting that they are showing that a second dose is indeed very effective and really increases the immunity for both serious and severe COVID infection and also moderate to severe infection. Certainly, the single dose is very highly protective for hospitalization and to prevent death from coronavirus.
Well, all companies behind the 3 approved vaccines in the U.S. have conducted studies on booster shots. Do you believe all Americans will need an extra dose at some point? And if not, what factors might determine who does?
So certainly we've seen the FDA come out in their vote last week that older people older than 65, and patients with immune systems that are not strong, so anyone taking chronic steroids or anyone with immune system problems really need a booster, and they voted to approve that right away. So I think we'll be seeing those patients get boosters across the country as soon as possible. They also included anyone who's at repetitive high-risk exposure, so your frontline healthcare workers, your paramedics, anyone who is regularly taking care of patients who are very sick with coronavirus and have obvious ability to transmit that virus. So those people are eligible and the FDA voted to support boosters for them currently. I think the question really lies for everyone else. And right now, the FDA was saying that the science does not show a really strong reason for boosters for everyone. And that's because the vaccinations, as they stand, offer a very strong amount of protection to prevent hospitalization and to prevent death from coronavirus. And that is what a vaccine is supposed to do. Now, we've certainly seen breakthrough infections. So people who are vaccinated have gotten COVID, especially with this Delta variant. And I know that that is scary. That makes everyone scared that their vaccine is not working. But in reality, those infections are very short in nature and not serious. Almost across the board, we've seen next to no hospitalizations and next to no deaths in patients who are vaccinated, who are younger than 65 and who have normal immune systems. So what the FDA and what other scientists and virologists across the world really are saying is that our current vaccines work for patients who are young, healthy, and have a good immune system, and that a booster is not required for additional protection, that the additional protection from a booster is not going to change things demonstrably for an individual person or for our communities at this time. And that's why they voted the way that they did. And I know that it's confusing because the Biden administration had really come out in favor of boosters. I personally think that we will all be getting a booster sometime in the next 6 months to a year. I think that this is somewhat similar to other vaccines that we've seen, such as the hepatitis B vaccine or the HPV vaccine, where it is pretty common practice that we have to get multiple vaccinations to have long-lasting immunity against a virus.
I think it has been confusing for so many people, but it's really important to keep in mind that context that you laid out for us. Dr. Hilary Fairbrother. Dr. Fairbrother, thanks very much for sharing your expertise.
Happy to be here. Thanks for having me on.